Good morning. My name is Dianna Church. I'm a first year student at Pacific University in Oregon, and I'm joined today by Jose Reyna. Good morning, and would you like to give a little introduction about yourself?
Sure. Good morning, Diana. My name is Jose Reyna. I am a faculty member at the University of Western States. I'm also a licensed physical therapist and practiced for a little bit over, I want to say close to 11 years. Living within the Portland area, doing a lot of stuff lately. Yeah.
Awesome. Okay, so let's see. First question I have for you is you've done a lot of pro bono work in your career, and just wanted to learn, how did you become involved for pro bono work in the PT field?
Yeah, my first opportunity to work with folks in the pro bono field were at Pacific University. I think that's currently where you're at. So um, we had a clinic there where I basically would practice and then offer services to folks at Virginia Garcia Memorial Health Center and then also Rockwood Medical Clinic and the Neighborhood Health Center. They didn't have anything established, you know, fully well until I joined, and then they dedicated one faculty member for that particular reason. And that's how I initially got my foot in the door with, at that time, it was the director was Dr. Richard Brett, and I had mentioned to him, I'm interested in opening a facility, within your compound, obviously. And yeah, one thing led to another, and that's kind of how it took off. And then I just kind of, delved myself into the realm of pro bono work. And then I involved myself with Salute Services, which is another organization in the metropolitan area that offers, consultation services and nursing services to organs vineyard workers. I then, branched out from there. I left Pacific, and then I spoke with folks over at the Virginia Garcia Memorial Health Center, which has the broadest, diverse of patients, and they also serve. They're a federal qualified health center, which is FQHC, and they also offer a lot of pro bono services to clients. And I figured, they were one of the bigger, contributors to the Pacific University's clinic as far as the patient load goes. And so I figured, why not just contact them and see what would come about this. And sure enough, we developed a plan to implement a clinic prior to COVID, but since COVID took place, it's one of those things where, patient care becomes a priority, and then obviously not exhausting the resources such as those needed for, you know, uh, hygienic purposes like the masks and stuff like that. So it wasn't a good time to have me in there. So we're still kind of pending on that to
Yeah.
kind of see how that goes. And hopefully before too long, once these things transition, it's just hopefully a matter of time.
Yeah, nice. What was this something that you knew you wanted to kind of be involved with following PT school, or was there something that kind of sparked an
Yeah,
interest?
it was. It was. I was actually
Mhm.
involved with Salute in my graduate
Okay.
program at Pacific University. I did some work study and I got to know the organization really well. And then I worked alongside Leda Garside,
Mhm.
and she basically showed me the ropes as far as what they offer a lot of organs vineyard workers. And my parents came here also by way of like work visas and stuff. And so I figured, why not, give back to, the individuals that, bumped shoulders alongside my parents at one point or another. And I also went to Virginia Garcia as a child, so I
Mhm.
know exactly what it is that they offer. And I figured, that's a good model, and that's where I want to be.
Yeah, that's awesome.
Yeah.
Can you tell us about the work and care you provide for the underserved communities?
Yeah, so a lot of the care that we offer are primarily physical therapy services when we are out either at the vineyards at that point in time, and then also while at Pacific. But since I've left, the only thing that I'm currently able to do is still pursue the opportunity with Salute Services, and then also with Virginia Garcia Memorial Health Center. So again, even in those carriers or facilities, I should say, we basically are going to offer, no different than what we were offering anywhere else, which is physical therapy, consultative services for, any sort of overuse injury, any sort of work related issues or ergonomics, things like that. So mostly just helping folks with their chronic diseases and or acute symptoms and things like that. So mhm.
Mhm. Is there a field or part of physical therapy that you specialize in?
Yeah, I have my I have my board certification in orthopedics. So yeah, I primarily stick to that. I previously did
Mhm.
some work in neuro subacute inpatient. at Rio. So I was there for about 6 years, but usually it's any sort of like neurological outpatient. I really enjoy working with that group of individuals, mostly because, especially after, having the round of like, the first 6 months to a year of, acute, oh, okay, get this person well, get their medication, get their blood pressure controlled, get their diabetes controlled, and all these other things. And then after 6 months or a year of therapy, and then it's like, then what? They've exhausted their services. So that's kind of where I came along, especially at the clinic. While at Pacific we had worked with another colleague of mine there, Dr. Katie Farrell, who did what they call was like a series of individuals from the community would come in yearly, and students from second year would then be allowed to screen them and provide some consultative services. So a portion of my responsibility was not, it wasn't really a note for me to be doing this, but I basically assisted them in drawing patients from the clinic and saying, hey, listen, if you would like additional care outside the current care that you have, because we had folks coming from as far as Troutdale, Longview, Washington. And so, I mean, there was only one facility where these individuals could go, and they mainly heard from us from some of the outfits I've named earlier. So yeah, I really enjoyed not only outpatient ortho, but I also enjoy outpatient neuro.
Yeah, nice. What has been the most rewarding part of your pro bono work, and why?
The most rewarding part of my work has been to offer someone something when they've kind of just given up, and just knowing that I'm there and there is resources available for them. And that's kind of the biggest thing, is just being able to help them recoup. Maybe they just want to be able to, address their flexion contracture if they had like a, stroke. Maybe they want to just be able to stand independently. Maybe they want to just be able to work a day with minimal issues rather than having this ongoing battle with chronic low back pain. Maybe they just want to hold their grandchild. I think for me, being a part of that is a huge bonus on my end, obviously, and that's kind of selfish, but I think overall for them, it gives them an alternative to seeking services that they otherwise wouldn't have access to.
Yeah, definitely. I think that's something that I worked as an aide in the community I grew up in, and a lot of the PTs that were hired came back into that community, and it's something that I just like really value, and I've like started to become really passionate about just giving back to the community. So
sure,
that's an awesome answer. Yeah,
it's great.
How do you see physical therapy impacting underserviced communities in the future?
As far as physical therapy, I know they're opening up a few schools here. There's one in Lebanon, the Western, and there's also one in Bend, Oregon State University. I know a few folks that, are in both programs, and they have actually, I think portion of the curriculum is to have students come into the clinic. So I would imagine there's also George Fox, which has their own pro bono facility. So I imagine that as these programs continue to expand, that the issues that we had, prior to the development of these programs will continue to be addressed in an ongoing manner, which is great. I think that's one of the best things we can do for our communities, is not only learn and teach students, but also be able to address the concerns that a lot of our community members would otherwise have no option for. So yeah, I think both those programs currently have it. I'm not sure what the current status is of other programs, but I know at least those 3 programs do.
How do you encourage students and your colleagues to become involved in volunteer efforts?
The best way to get involved is just, like I said, start knocking on doors, to be honest with you. Follow dead leads, and make sure that, do it because you want to do it. Don't do it because it's a good thing to look forward to on your resume. That's just kind of, what do they say, padding your CV. Otherwise, there's no joy in it at the end of the day. You just kind of feel like you have to go on a certain day. And I've seen some of that, but I would just say that most people do definitely go out to, help the community and give back and serve for their personal reasons. But yeah, just keep knocking on doors like I've done all my life. That's how I started at Pacific. I just knocked on the door and I asked, and then one thing led to another, and here I am. And then I also, knocked at Virginia Garcia's door, and again, one thing led to another. And you have to commit yourself, even though sometimes the the daunting effort of paperwork and having to get yourself authorized, credentialed, and all this stuff can be overwhelming. And it's a long process. At the end of the day, is if you're committed, things will naturally fall into place. So yeah. Other things I would recommend folks do is reaching out to some of these other venues. For instance, once I get things rolling with Virginia Garcia, hopefully I'll be able to contact folks that I know are really interested, and just hopefully word of mouth will come around, and I'll have folks knocking on my door before too long.
Yeah. Is there a certain patient or a certain situation that you remember really stuck out to you as just being memorable or inspired you?
Yeah, I think, well, there are two, and they both had to do with somebody having the ability to walk. They came in paraplegic. One came in almost tetraplegic, and so they both had neurological disorders. Another one had just like a rapid onset and deterioration of motor control. And so this individual, I had treated them previously for a knee injury that they sustained at work, and they came in and they were just completely they were very, very minimal movement of the upper extremities. And it was very tough to see, because just a month ago, this person was walking around like me and you. And of course, naturally, they didn't want to be seen in that state. So they were crying. And a big part of me wasn't sure. I mean, obviously, because it was just a rare condition, whether or not they would get their motor function back. And ultimately, we got to the point where we were walking them in a front-wheeled walker and utilizing some leg supports, some AFOs. And by the time we were done, it was one of those things where the person would rather lose out on any sort of life activity, any sort of social avenue, just so she could keep her appointment. And that's one of those things where someone is committed to their health and someone's committed to their rehab. But it just dawned upon me, I hope that if I were in that same situation, I would have, the resources available to me, but also someone who is genuinely caring and able to help me get there. Because I think that's part of it, is just crossing the barrier where they almost essentially see you as not only their provider, but at least for a lot of the folks I treated, you're kind of an extension of their family, right? So they come and see you for an hour at a time, and they do this 2 or 3 times a week, just kind of depending on what the situation is, mostly 2 times a week. But they come in to socialize. They tell you everything, about their life in that hour. And it's up to you to, you're playing 2-part role. It's, you're kind of being a counselor and kind of just helping them cope with the difficulties they're experiencing outside of rehab and trying to help them stay positive, and then coming to understand that, you are their PT, you are there to help them get better. And so that transition, that moment when you realize that, damn, I did this, like, I am helping this person and they are excelling beyond, all possibilities that you thought of when they initially came in, and, not knowing what the condition was truly because it's so rare was huge. And that's a really big impact for me. Yeah.
But are there any parts of PT, like outside of direct care, like with regard to maybe like nutrition or psychology, that you also find interesting to bring into your plan of care, your practice?
Yeah, a lot of it has to do with, I'm on the Culture and Minority Affairs Committee, so understanding some of the health disparities and some of the reasons that individuals don't typically have access to care. So that's one of the big things for me is, everyone's going to be, when you read some of these research randomized control trials, you always take a look at who is it comprised of. It's usually, middle-aged individuals, and some of these individuals are obviously outside of your, 16 to 60 or 18 to 60 or whatever age range that is oftentimes used. But then you start looking at like the, diversity of the population. It's like, well, this is great, but it doesn't necessarily apply to the patients that I'm currently working with, or the socio-ecological status of those individuals. So with that being said, I think for the most part, when you do address those concerns, it's important to understand that, just making sure you're cross-referencing all the different things available to them. Obviously, if someone's having some issues with mental health situations, you want to reach out to folks and stay well connected. So I think a lot of motivational interviewing is also a big barrier, making sure that, you know, why is it that the person, you know, is not doing their exercises? Well, they have kids at home. Maybe they have responsibilities of a homemaker and they have to cook, and you're giving them 20 different exercises. Maybe just give them one exercise they can do in the car while they're driving home. It's not super important to give them 80 exercises as opposed to give them something that they're going to be able to do, you know, like the best exercise program is the one that your patient will do. And so that's the other thing is making sure you understand what it is they're coming from, what they're willing to do. And, you know, obviously when you have a follow-up visit, you can check on whether or not that's being accomplished. But yeah, I would say mental health services, motivational interviewing. I typically don't go outside of my scope of practice, although if it is necessary to refer someone out to, you know, someone who's involved in nutrition, someone who's involved in acupuncture, or any of the other alternative medicine type stuff, I definitely would recommend. I think what's important to understand is based on the evidence, obviously, some of the services may not well be supported, but you're not there to give your personal bias. Sometimes you're there to support your patient, and supporting your patient is the most important part. Otherwise, again, you're not going to cross that barrier. I was explaining it previously. Have your, you know, explain the benefits and the pros and cons of any sort of care. For instance, I would oftentimes tell my patients, hey, you want to try some homeopathy? And I'm going to tell you right now, the evidence isn't great for it, but you know what? Why don't you give it a trial and see what happens? If after, you know, 2 weeks to 30 days, it don't work, then you should probably reinvest your money in something that will work, or something like therapy, or something that will help you, you know, maintain those gains that you want or achieve different gains that you want. So that's just my bit of disclaimer when patients do ask for those. But I never discourage patients from, you know, seeking out, obviously, and educate them, but if they go out and do what it is they want to do, then they're going to do it. And it's important for you to be supportive, but also be supportive in a role that you're educating them at the same time as far as what the benefits are.
Nice. That is all the questions I had for you. Thank you for joining me today.
Yeah.